63-year-old female presented with history of headache and diminishing vision. She was not a diabetic. This video is to show the anatomy of the structures related to the sphenoid sinus. You can see in the CT scan the variable Hounsfield unit filling the sphenoid sinus, eroding the right lateral wall. You can see also the intersphenoidal septum. You can see the MRI, very typical of fungal sinusitis. The septum in the posterior end was eroded, so it was easy for us to perform a binostril technique. You can see that the sphenoid is filled with fungus. In such a situation, there are two ways of removing this fungus. One is by applying suction, as we're doing here, or by irrigation. It is not advisable to use the debrider inside the sphenoid sinus, nor is it advisable to use very forced irrigations. Now you can see that the mass is coming out. We're taking a Takahashi forceps to remove it, send it for culture, and the mucosa is taken for biopsy. You can see the fungal mass in the clival recess. We're now using a suction to clear the clival recess there. You can also see the pulsations already in the suprasellar region as well as the sella, completely deficient of bone, typical of allergic fungal rhinosinusitis here. The allergic mucin, the greenish material which is being sucked out there. Now we're giving irrigations with warm saline. So this video is primarily to show the anatomy of the structures related to the sphenoid sinus. You can see clearly how that is the clival recess and the sella out there right in the middle of your picture, and you can see the intersphenoidal septum now, which is exactly corresponding to the CT scan. That's the right sphenoid sinus. It's not advisable to pluck the intersphenoidal septum with a shearing instrument because that is going towards the carotid. It's very obvious there, towards the left carotid. And now we're trying to separate that mucosa from the bone so that we don't strip off that mucosa. If we pull that, the whole mucosa will come out. We don't want to do that, and so we are trying to remove that bone separately using a Freer's elevator to separate the mucosa from the bone. And once we have separated that, we'll be using a Blexley-Weil forceps to remove only the bone there. And then the excess mucosa is removed using a through-biting forceps. And once we give a wash, we can now see the structures very clearly. And now we are going to study the structures related to the interior of the sphenoid sinus. Let's start from the bone above is being removed from the region of the planum sphenoidale. That is the region of the planum sphenoidale which forms the roof of the sphenoid sinus. And below it will be the tuberculum sellae between the two optics. And here we are, this is the sella. You can see that there is no bone, and this is the clival recess. So the first would be in the midline, the planum, the tuberculum, the sella, and the clival recess. This is the paraclival carotid. of the left side, and this is the paraclavial carotid on the right side. And you can see that the paraclavial carotid, this is how it goes. That is the cavernous carotid, and you can see it's coming in front, and it goes and forms the paraclinoidal carotid, and that is the paraclinoidal carotid now, and it goes there into the intradural carotid. So that is the optic nerve there, and that is the optic strut, lateral opticocarotid recess, and this optic strut separates the optic canal from the superior orbital fissure. That is the anterior wall of the cavernous sinus there, very clearly seen, and that is the superior orbital fissure, which is just anterior to it, and that is the superior orbital fissure. Just below the superior orbital fissure would be a bone called the maxillary strut. It separates the V2 from the superior orbital fissure. So that's the anatomy of the sphenoid sinus. Thank you very much.